Precision laser therapy for inoperable brain tumors. Production of Biotechnology Kiosk, biotechkiosk.com. Biomedical challenges in combating primary brain tumors. About primary brain tumors. Hundreds of thousands of people in the world are affected by brain tumors annually. Primary brain tumors are considered quite aggressive that show rapid progression, which results in a short survival time from the time of diagnosis with or without standard care. Major biomedical challenges. Among the most common and deadly forms of malignant primary brain cancer, glioblastoma, GBM, is considered a very serious medical condition. It is well documented that GBM results in a high mortality rate within 14 months of diagnosis of the disease in patients of all age groups. Available therapy for brain tumors includes a combination of surgery, chemotherapy, and radiation therapy. However, a major challenge with the standard therapy is associated with the recurring of such brain tumors even in the case of a successful therapy that leaves patients with few options. This is due to the reason that most people diagnosed with GBM usually undergo surgery that involves removing part of the skull to cut out the tumor. This procedure is then followed by both chemotherapy and radiation. However, unfortunately, the tumor inevitably comes back after some time. A repeat surgery could then be a possibility, but a repeat surgery is considered too expensive and complex for many patients, and hence not recommended. In addition, a vast majority of brain tumor patients are denied surgery due to the obvious concerns of damaging the surrounding healthy tissue. New therapeutic approaches based on thermal therapy have been considered that could potentially increase survival time. To this end, researchers have studied brain tumor models that are essential for understanding the molecular and anatomic impact of this approach. However, the challenge is posed in high-grade gliomas, where due to poor animal models of the disease, along with the refractory and diffuse nature of these tumors, make the thermal therapy difficult to be applicable, especially in the treatment of GBM. How lasers can potentially be the game changer in recurrent or inoperable tumors. The promise of precision laser therapy. Laser-based therapy has emerged as a hugely promising approach to treat brain cancer. It is considered a potential game changer in brain tumor treatment due to the advantage of the technique that allows breaking down the blood-brain barrier. The blood-brain barrier shields the brain from toxins in the blood, but it also blocks potentially helpful drugs such as chemotherapy to enter in the cellular region affected by the tumor. Laser-based therapy can overcome this problem. Researchers have demonstrated that the blood-brain barrier can be broken down for about 4 weeks after laser therapy is completed. This essentially implies that along with killing the tumor, breaking the blood-brain barrier could open up a window of new opportunity to deliver various drugs and chemicals and therapies that would otherwise not be possible to achieve. This major breakthrough could lead to new treatment options for patients with the deadly disease of brain tumor. Laser-based therapy is precise and can treat aggressive, hard-to-reach brain tumors with minimal damage. Lately, magnetic resonance imaging, MRI, guided laser interstitial thermal therapy, LITT, has emerged as a powerful technique that offers hope to treat recurrent or inoperable tumors with chemotherapy or a heat therapy instead of performing invasive surgery. In the LITT procedure, a tiny hole in the skull is drilled and then a laser is inserted, which is then guided through the brain to the tumor on a path that is designed to cause the least damage. The laser is then allowed to enter inside the tumor to emit pulses of heat that kill the surrounding tumor cells. Real-time MRI images of the brain are subsequently sent to a computer screen that allows monitoring where the laser is working. MRI-Guided Laser Interstitial Thermal Therapy. MRI-Guided Laser Interstitial Thermal Therapy, LITT, is a novel, minimally invasive neurosurgical procedure that corresponds to the selective ablation of a lesion or a tissue using heat emitted from a laser device. The procedure employs a laser light, which is sent through a stereotactically positioned probe to an intracranial lesion for controlled thermal ablation of the pathological tissue. The advantage of LITT is that the procedure can provide a non-surgical solution for patients who cannot tolerate surgery. Further, combining with the MRI technology is a big advantage that significantly improves lesion targeting that can be leveraged for real-time accurate monitoring of the thermal ablation process. brain tumor glioblastoma treated with real-time MRI-guided laser interstitial thermal therapy. In a recent study of major significance, researchers performed 58 LITT treatments for GBM in 54 patients over 5.5 years. Among these cases, 41 were recurrent tumors, while 17 were frontline treatments. Further, researchers used 40 GBMs that were labor in location, and the rest 18 were identified as deep structures, thalamus, insula, corpus callosum, and the average tumor volume was noted to be 12.5 plus or minus 13.4 centimeters cubed. Most importantly, the median overall survival after LITT for the total group of patients was found to be 11.5 months, along with median progression-free survival 6.6 months. This important clinical study using MRI-guided LITT on patients with GBM, both frontline and recurring cases, showed LITT as a safe and effective treatment for GBM in properly selected patients. In addition, such hyperthermic methods can induce temporary disruption of the peritumoral blood-brain barrier that could be leveraged for potential use to enhance drug delivery in the peritumoral region where most recurrent GBM occur. This could be immensely helpful to overcome the limiting factor concerning poor central nervous system penetration of cytotoxic drugs due to the blood-brain barrier that could pave the way for new therapeutics in the treatment of brain tumors.